Hello and welcome to the Sharp Psych. Today we'll cover what is separation anxiety disorder and what is the difference between adulthood and childhood separation anxiety disorder. This is a type of disorder defined by anxiety or excessive fear of being separated from a person or place that provides a sense of security or comfort. This condition can occur in both childhood and adulthood, though the symptoms and underlying causes may differ. Before we get started, make sure to check the links in the description to find out more about interesting facts and recommendations about psychology. And don't forget to subscribe and turn on notifications. Alright, let's get into it. The condition known as a separation anxiety disorder in childhood is quite common and affects a significant number of children. It's characterized by an abnormally high level of fear or anxiety when the affected person is separated from a caregiver, such as a parent, grandparent, or teacher. This fear or anxiety can lead to significant distress for the child, and it may impede the child's ability to participate in normal daily activities such as going to school or spending time with friends. Some of the symptoms of childhood separation anxiety disorder can include excessive anxiety or fear of harm coming to oneself or a caregiver, refusal to go to school or engage in daily activities as usual, trouble falling or staying asleep when the caregiver isn't around, frequent nightmares or night terrors, physical symptoms like nausea, headaches, or stomach aches when being separated from a caregiver, panic attacks or temper tantrums when away from the caregiver. Childhood separation anxiety disorder can be caused by a variety of factors, including genetic predisposition to anxiety disorders, traumatic or stressful life events such as moving to a new home or school or experiencing a death in the family, overly protective or strict parenting techniques, lack of exposure to new experiences and people, leading to fear of the unknown. Both cognitive behavioral therapy, which helps children identify and challenge negative thoughts and behaviors, and exposure therapy, which gradually exposes the child to separation from the caregiver in a safe and controlled manner, may be used as treatments for childhood separation anxiety disorder. Even though separation anxiety disorder is most commonly seen in children, adults are not exempt from the possibility of developing the condition. Adults who suffer from separation anxiety disorder exhibit an abnormally high level of fear or anxiety whenever they are physically separated from a person or place that is associated with feelings of safety or comfort, such as a spouse, a parent, or their own home. Some of the symptoms of adult separation anxiety disorder can include a constant concern for the safety or well-being of a loved one, refusal to travel or participate in activities that would require separation from a loved one or from one's home. Physical symptoms may occur when anticipating or experiencing separation from a loved one or from a home, such as headaches, nausea, or chest pain. Panic attacks or extreme distress when separated from the loved one or home. Adult separation anxiety disorder can be caused by a variety of factors, including trauma or stressful life events, such as a divorce or job loss, genetic predisposition to anxiety disorders, an insecure attachment style, which can develop as a result of childhood trauma or inconsistent parenting, a history of anxiety or other mental health disorders. Both cognitive behavior therapy and exposure therapy may be used to treat adult separation anxiety disorder. It is essential to keep in mind that separation anxiety disorder in adults may also be a symptom of another mental health condition, such as social anxiety disorder or obsessive compulsive disorder, which may have been present from a younger age. It's critical to seek the assistance of a mental health professional in order to arrive at an accurate diagnosis and successfully treat the underlying condition. Now that we discussed childhood and adulthood separation anxiety disorder, let's look at the differences between the two. There are some key distinctions between childhood separation anxiety disorder and adulthood separation anxiety disorder. Despite the fact that excessive fear or anxiety characterizes both when separated from a person or place that provides a sense of security or comfort, adult separation anxiety disorder is less well known and may be underdiagnosed. On the other hand, a separation anxiety disorder in children is more commonly recognized and diagnosed. The focus of the anxiousness is yet another key distinction. The fear of oneself or one's caregiver coming to harm is typically the primary concern in cases of childhood separation anxiety disorder, also known as CSAD. Adults who suffer from separation anxiety disorder tend to be preoccupied with the worry that they will be parted from a loved one or their residence. The ways in which the disorder is treated can also be different in various settings. Treatment for childhood separation anxiety disorder typically involves the participation of both the child and their primary caregiver. This is due to the fact that the child's anxiety is typically related to their attachment to their primary caregiver. treatment for adult separation anxiety disorder places a greater emphasis on the patient, as well as the fears and thought patterns that lie beneath the surface of the condition. Both childhood and adulthood share some similarities, including the importance of seeking professional help. A certain amount of fear or worry about parting ways with a loved one is perfectly normal. However, excessive fear or anxiety that gets in the way of daily activities and causes significant distress should be addressed by a mental health professional. Let's talk about some tips for coping with separation anxiety disorder. There are a few different approaches that can help you manage your symptoms and deal with the difficulties associated with being apart from your loved one. It doesn't matter if you have a separation anxiety disorder as a child or as an adult. These approaches can help you manage your symptoms. As was previously stated, separation anxiety disorder is a condition that can be treated. Working with a professional in the field of mental health can assist you in determining the factors that are contributing to your anxiety and in developing methods for alleviating its symptoms. It's possible to alleviate feelings of anxiety and foster a sense of calm through the practice of relaxation techniques, such as slow, deep breathing, progressive muscle relaxation, or visualization. Many people with separation anxiety disorder also struggle with negative thoughts and worries about the possibility of harm to themselves or a loved one. It's possible to lessen feelings of anxiety by disputing these thoughts and replacing them with others that are more grounded in reality and optimistic. In exposure therapy, the patient gradually confronts the situation or object that causes them to experience anxiety in a way that is both safe and under medical supervision. This has the potential to desensitize the individual to the stimulus that causes anxiety and reduce the individual's overall level of anxiety. Keeping in touch with loved ones through means such as phone calls, text messages, or video chats can help alleviate feelings of isolation while simultaneously fostering a sense of connection and fostering a sense of safety. Regular exercise, maintaining a healthy diet, and getting a sufficient amount of sleep are all things that can help promote good physical and mental health, which in turn can help reduce anxiety. Reading a book, taking a relaxing bath, or engaging in a yoga practice are all examples of activities that can help reduce stress and promote a sense of well-being when one makes an effort to engage in these activities on a regular basis. Whether it strikes a child or an adult, dealing with the symptoms of separation anxiety disorder can be a challenge. This is true regardless of the age at which the condition manifests itself. Nevertheless, it's possible to live a life that is fulfilling and meaningful while managing the symptoms of this condition, provided that the appropriate treatment and coping strategies are utilized. It's imperative that you seek assistance of a mental health professional if you or a member of your family is experiencing excessive fear or anxiety related to the prospect of being apart. It is possible to overcome the challenges posed by a separation anxiety disorder and achieve a greater sense of peace and well-being if one is provided with the appropriate support and direction. We hope that this video provided you with valuable information to better understand what is separation anxiety disorder in adulthood versus in childhood. Thank you for watching, and we'll see you in the next video.